So I guess we're back by popular demand. I don't know, I've always wanted to say that. If y'all wanted me to give y'all just some medical content, I could have said that. We have a patient coming in that I'm going to show you guys how to set up for a hemorrhoid banding. So what is a hemorrhoid banding? So essentially it's a procedure where patients come in that have internal hemorrhoids. We literally place a rubber band around the base of that hemorrhoid. And what it does is it cuts off the blood flow to the hemorrhoid, eventually allowing it to shrink in size and then fall off. So a lot of patients come in with symptoms, painless rectal bleeding during bowel movements. You have what you call a hemorrhoid protrusion, where the internal hemorrhoid is actually starting to peek out through the opening of the anus. And of course you can imagine how much discomfort that would cause. Again, you know the drill. Start with your gloves. First, what do we do before we do any procedure? We get them to sign a consent form. It doesn't require sedation necessarily. A lot of things I will mention. You want to avoid straining during any of your bowel movements. You want to stay hydrated. Also, a high fiber diet kind of allows your stools to kind of gain more bulkiness. So that way when it's time to go, it drops. You don't gotta, So, fun fact, but let's get set up. So when the patient first walks in, we have them lie here on this good old bed. Then they're going to put this little blanket dress thing on to cover their bottoms, their knees to their chest, and face the wall. It gives us better access of the anus. Y'all know I'm good for keeping me some gauze. We're gonna need some hemorrhoid relief cream. This acts as an anesthetic a little bit just to kind of make it a little bit more bearable. Gotta have that lubricating gel. We have what we call an anoscope. Allows the area to be illuminated when they're trying to kind of open it up a little bit so they can see inside. Pop. You can see it's lit up, right? Now that we have that set up, now we're going to open our hemorrhoid ligator. So this is the actual tool that once we see inside, then we can go ahead and place those rubber bands. Are we following? Stay tuned. This is what it looks like. This applicator, I know it looks sharp. Don't fear. Hemorrhoid rubber bands. They're literally rubber bands. So if you're a visual learner like me, here's something to help you. So this is the rectum, of course. This is an internal hemorrhoid. It's actually a really good depiction of one. This right here would be an example of an external hemorrhoid here. So internal, external, outside of the anus. This would be a normal hemorrhoid. And you see how this is prolapsed, or this is starting to try to peek through. So it's working its way down here. And that would be an external hemorrhoid. I'm not an MD, NP, CRXTYZ. I'm just here to spread the gospel, okay? So y'all remember this tool from earlier? Use this to grip the rubber bands. We're gonna take it and we're gonna stab it in one of the rubber bands, trying to get this on our ligator. So we're gonna push it down. You gotta move a little fast because it is tricky. Gonna place our hand at the base. Air down, good. So we're here, it's locked in. Remember gripping it at the base, getting that rubber band down all the way, pop, boom. Now the rubber band is applied here. It's ready to be inserted into the anus. This kind of works as a suction to go around the hemorrhoid, and then when they push from this base, it's going to release the rubber band around the base of the hemorrhoid and get to sucking the life out of it. So once those are all placed, the bands typically do start to fall off in about 2 to 3 days. Let me fact check, hold on. In about, I believe, a week, you'll start to notice the results. You'll start to have a lot more relief. You can continue on with regular day-to-day activities. Of course, this is going to vary in different patients, so don't take it at face value. If as soon as you get a banding, you get home and it comes right out. Call your GI doctor, set up your appointment, come back in, and we can always redo the procedure. So the patient actually just got done with the banding. I just ran back in here to clean up before I go to lunch. And I put everything in the biohazard dumpling. Put this in freaking biohazard. And then we're done. Tweedie the clinical baddie, you feel me? I'm about to coin that too next. I'll catch you guys next time.